Hi, I'm Dr. Stephen Lacson. I'm a dermatologist. Welcome to HOO Dermatology here in Manila, Philippines. So, syringoma, these are tiny bumps, skin-colored bumps that you see usually around the eye area. So, you can see clusters of these little bumps under the under eye and sometimes in the upper lids, and these are usually symmetrical. But there are also cases where you also see them in other parts of the body. So the difference between syringoma and milia, in syringoma, as I mentioned, they appear as skin-colored tiny papules also around the eye area. But in milia, these are tiny papules that have a whitish material inside. So when you look at them, these are easily extracted. So we can tell the difference just by looking at them. Syringoma is actually an overgrowth of your eccrine glands or your sweat glands, and that's how they appear on the skin. And in terms of hereditary, actually syringoma is sporadic, meaning there's no pattern, it can occur randomly, so you don't really know who's going to develop syringoma. But there are a percentage of patients where it's hereditary. So when it comes to persons at risk of having them, it can happen to anyone, as I mentioned, but there are a percentage of patients who have certain syndromes where it occurs more often, such as your Down syndrome, your Marfan syndrome. And regarding lifestyle and all that, it occurs more in women. I haven't seen syringoma in men, and it usually comes out during puberty or young adult. Well, there are different kinds of syringoma. The most common is your localized syringoma, which is the one we usually see in our clinics, and these are usually around the eye area. And you also have those that I mentioned, which are associated with your Down syndrome, which can happen in 20% of these patients, and also around the eye area. And you also have those generalized syringomas, or the multiple or eruptive type of syringomas. Now, these are quite rare, but they do occur, and they occur more often in dark-skinned individuals and are not limited to the face. So they can appear also on the chest, the axilla, and the genital region as well. And the last one, the fourth one, is your familial type, which is hereditary type of syringoma. Syringoma can be treated, but again, most of the treatments out there, the syringoma tends to recur and come back. You have to remember that the patients who come in for syringoma treatment come in for cosmetic reasons. So when they come for treatment, the usual treatment we offer are the first one is electrocautery. Now, this is the most common type of treatment that clinics do because it's affordable. Ablates the surface of the syringoma. But you have to remember the syringoma is found in the upper dermis, and it's just not on the surface. So when you just ablate the top, it's still there. So it will still recur. It can come back within a year or 6 months, but it will come back. Now, aside from electrocautery, you have your CO2 lasers or your erbium YAG lasers, where the same concept, you're trying to ablate the lesion, but the advantage of the lasers is there's less thermal damage around the syringoma, so it's a little more expensive. But again, since you're only burning the top, it will tend to come back as well. Now, aside from lasers, what do we do? Now, usually these patients, when they come back, they keep on doing it because it always recurs. So you have to help even out the skin, because you can have texture problems or discoloration in the area. So you can do your fractional CO2 lasers, you can do your chemical peeling on the area to help even it out. Now, this can sometimes frustrate patients because it keeps on coming back. So it's like it's forever there. And it can cause some scarring on the area if the doctors are too aggressive. So there are new treatments nowadays. We have what you call an AGNES procedure for syringoma, where it uses insulated RF ablation. So what does this mean? So since you know that the syringoma lesion is deep, it uses an insulated needle to target the core of the lesion. So when you insert it, there's no burning or damage to the surface, so there's no scabbing. But on the tip of the needle, it zaps the middle of the syringoma, so you're hitting the core, and this causes the regression and the shrinking of the syringoma over time. So right after the procedure, there's hardly any downtime. You have like a redness or a little swelling for 1 or 2 days, but it will start to regress in 1 or 2 months after the procedure, and the results are long-term. So it's not gonna keep on recurring. So this is a breakthrough, I think, in the treatment of syringoma. So when it comes to preventing syringoma, as I said, it's sporadic. So it can happen. If it's gonna come out, there's a big chance it's still gonna come out. But what can we do to just help prevent a little and lessen the appearance, especially if you know you are very prone to syringoma? So one, you wanna use some exfoliant, but since it's usually around the eye area, you have to make sure you're using a gentle type of exfoliant. And two, you want to avoid any stress or damage to the skin on that area. So you want to avoid irritating products. You want to keep the skin well hydrated with the use of moisturizers. You want to protect it from sun damage using sunscreen. And when it comes to time when you want to have it removed, consult a dermatologist. Better someone who has experience with removing syringomas to remove it properly.